Department of Orthopaedic Surgery at Johns Hopkins Hospital. And although he's recently retired from full-time surgery, he remains teaching faculty at the Curtis Hand Center and continues to help with the performing artists at the Musicians Clinic at MedStar here locally. He has published many papers and many presentations and book chapters, and we're very honored to have him talk to us about this special expertise.
Gosh, thank you, Andrea. That was very, very nice. Appreciate that. It's a pleasure to be able to be invited and to make this presentation. I've often given a lecture to our trainees on performing arts, which is not as well attended, shall we say, as some other talks that we give. But I'm very fortunate early in my career to have one of my mentors, Dr. Gaylord Clark, who was also part of Hopkins, but he recognized very early in his career sort of the unique nature of musicians and some of the problems they develop. And he got me interested in all this, and we got this clinic started, and we've been doing that for about 25 years. So it's been a journey and education in how to best treat these individuals. So we'll just get into it. So I like to start with this quote, because we're sports medicine, we're occupational medicine, we're surgeons, so we all worry about how, overdoing things, and we think of that as sort of a 20th century phenomena, but again, that's recognizing that overdoing things can lead to problems actually goes back to Dr. Bernardino Ramazzini, in the 16th century, where he wrote the first book on disorders of workers. So it's been around for a long time, but certainly it's not been popular up until recently. So again, I like to throw this out there for, especially when I'm talking to musicians about, the manufacturer of your body will not guarantee good function and will not provide replacements or refund. If you fail to follow the warranty, so fail to use your body for its normal purpose, fail to follow functional instructions, place your body excessive risk, expose your body to repetitive work and postures for which it was not designed, fail to take into account its limits and mechanisms for compensating for workloads, and fail to maintain your body in accordance with manufacturer's instructions on proper maintenance, which, as we all know, is all too common. So this is a typical patient, if you will, that often gets referred to us, a 17-year-old musician, been playing the violin since age 4, practicing 3 to 4 hours per day. Forearms start to ache, but not noticeably for a bit, but it gets worse. She's starting to have some pain with other activities like typing or writing. She visits her primary care doc, who suggests anti-inflammatories. There's an orthopedist who thinks she has tendonitis and tries some therapy, which does help for a little while, but the problems progress as she continues to play, and now can only play for 15 minutes before she has to stop because of discomfort. She had a recital canceled. She had conservatory auditions coming up. She's tried other things, massage, acupuncture, not helping. She saw a second specialist who ordered nerve tests, which were, of course, normal. And she was given the ultimate bad advice that all musicians hate to hear, that advised to stop playing. So she was getting pretty desperate. And of course, where do you go from here? You've been to 2 or 3 doctors, none of which have figured out what's really going on. So that's often not an uncommon presentation. especially among students in the conservatories. So, performing arts, obviously, you don't think necessarily of a performing artist and musician as being particularly dangerous or difficult. But, when you think about it, requires rapid, controlled, repetitive movements. Dr. Fry is a physician in England who, and I would tend to agree with this quote, that, playing a musical instrument is probably the most difficult thing we do with our hands. So keep that in mind. So again, the physical demands of playing music, certain pieces anyway, can be quite astonishing. An example, Mendelssohn Concerto, in 4 minutes, over 5,000 notes played, up to 23 notes a second. It's hard to imagine doing anything 23 times a second and having, 72 bimanual finger movements per second. Cello pieces have 740 arm movements. Playing the drum, 5,000 motions. Again, asking you to even do just flex and extend your arm for 5,000 times in the next 15 minutes would seem challenging. And again, not only do you have to do these, but these motions have to produce sounds that are absolutely precise with respect to the timing, the volume, quality, and of course the coordination usually with other musicians. So the question is, obviously the demands that they might place on their bodies would seem somewhat obvious to the careful observer, but again, it's not easily quantified. But I like to throw up this picture. You have, a rock drummer, or it's sort of obvious they get all sweaty in concerts, and you think that they're working very hard. And then you have a flute player who might be burning up their forearms, playing Flight of the Bumblebee or some other difficult piece. And who's really working harder here? So a little bit about the scope of the problem, and that it goes back about 45 years now that we really started surveying musicians. 1986 survey of 2,000 orchestra musicians. 82% had a medical problem affecting their career. 76 had a problem severe enough to limit performance. And it was all over, the strings, the woodwinds, brass instruments, other instruments, and, multiple problems, musculoskeletal, non-musculoskeletal, and both sexes. And again, all parts of the body were affected, fingers, hands, wrists, forearms, so back. So again, a widespread problem was identified at that time. So another more recent study, 1998, of 600 musicians, and these are prevalent studies now. So, a survey of a group at one point in time, 40% had a clear pathologic diagnosis, and 40% had diffuse aches and pains, and 20% had psychological or emotional problems. More recent study of conservatory students that again showed about a 79% prevalence of music-related pain. So multiple surveys in multiple countries have been done, and this seems to be fairly consistent as to this range of performance-related problems. And the lifetime incidence is often 100%. So definitely something that needs to be looked at. But again, only with the past 45, 50 years or so have we started to look at these problems. Obviously, the classical musicians are usually the most studied because of the conservatories. Amateur jazz and rock musicians are not as well studied, but performance-related musculoskeletal complaints, which is sort of a term that can be used to describe these types of problems, are rarely simple cause and effect. And I stress this certainly to our trainees and to anyone at the when a musician comes in complaining of a pain in a certain area, well, they might have a problem in that area. The cause is usually somewhere else. So it's usually a problem somewhere else that's causing them to overuse a particular area that's now causing pain. And that's the key to figuring out how to treat them. So these many factors related to the musician and the instrument, of course, contribute to the development of these problems. So musicians are often considered these small muscle athletes, as opposed to the large muscle athletes. I always like to point out, there are more professional musicians in this country than there are professional athletes. And like athletes, musicians perform for the public, and they can lose their job if they don't. But only athletes tend to work with physicians and trainers almost daily. I mean, most schools and even down to high school usually have a trainer or somebody on the sidelines or readily available. Yet, there's nobody in the wings at the BSO looking out for the musicians, saying, are they being overworked? So this is a highly competitive environment. There's a limited number of secure jobs. So again, performing arts medicine, which is starting to, has come into its own after all these years. It's addresses the special challenges associated with this sort of super normal function. This is not something that anybody can do every day. And performing arts medicine, I think, combines the injury experience of sports medicine with occupational medicine's focus on the overuse from the workplace. So again, you wouldn't really consider being a musician as a risky pursuit, but considering the potential for career-ending or career-altering injuries, being a professional musician is actually quite a high-risk occupation. And then once the injured musician decides to seek treatment because they're having a problem, there's certainly impediments that seem to inhibit that to a large degree. And again, I think as providers, healthcare providers, we have to understand that try and understand how they think. That music is not just what they do, it's what they are. And asking them to change that is like asking you to become right-handed or left-handed, or, it's just something you can hardly imagine. So there's a lot of peer pressure there to go along with continuing to play. This tradition of toughness, if it was good enough for Beethoven or Liszt, it would be good enough for you. So that's the way it has always been done, this tradition. And music is even worse than medicine, I think, in terms of this is the way it's always been done. So you don't want to admit that you're having a problem doing this. And then when you do go to the doctor, you often get this sort of, I don't really know what's wrong with you or how to make it better. So the providers aren't really aware. And of course, a lot of these musicians are young. They are either self-employed or unemployed, very limited, and don't have great insurance coverage. And of course, there's always the threat of job loss or having to withdraw from school. And this all becomes a factor. So what kind of problems do they get? Well, musicians are people, so they can get any of the other, all the usual orthopedic disorders. But most problems fall into three main categories: musculoskeletal pain, and we'll go over a lot of this, overuse injuries, hypermobility problems with lax joints, arthritis, obviously entrapment neuropathies, can be seen about 25% of the time. One of the arguments I always used to make about carpal tunnel not being job related usually is that you would think every musician would have carpal tunnel if overuse of your hands was the main cause. And in fact, again, it's somewhat anecdotal, but I would think musicians tend to get carpal tunnel less common than the general population. And then there's a somewhat unique category of focal dystonia and other issues that can arise from this. So we're going to focus on this. I mean, both entrapment neuropathies and dystonia are problems that you could devote another whole talk to, but we're going to focus mostly on the musculoskeletal system today. So again, when we talk about overuse or abuse, there's still no universally accepted definition of what these terms are. Again, this pain syndromes is probably a more accurate term since there's really not necessarily an inflammatory component to all of this, these symptoms. But basically overuse is a condition that occurs when any biologic tissue, muscle, bone, tendon, ligaments are overused, is stressed beyond its physical limit. And again, that limit can vary from day to day as to what it's able to endure, depending on a lot of factors that, again, we have to explore to figure out what's going on. So these are often classified as acute, meaning they sudden onset after specific activity. Sometimes you get a history of, oh yeah, we had a 3-hour rehearsal and my hands started hurting, after that rehearsal. Other times it's more chronic, it comes on slowly and gradually worsens over time. So there is a system for sort of grading the severity of these overuse injuries. It was also developed by Fry in England. That, level 1, you have pain only at one site and only while playing. Level 2 is you can start to have pain at multiple sites while playing. 3, you start having pain beyond the playing. So either the pain stops you from playing or it still aches even a half hour after you've stopped playing. And then 4 is if you still have pain while playing, but now it's starting to bother you whenever you do anything like typing or eating. And level 5, where we have experienced pain in a body part, whenever that body part is used. So obviously a wide range of causes here or potential problems. So, we're going to focus quite a bit on the evaluation, which I think is very subtle, and actually that's what got me into this somewhat too, even though I'm a hand surgeon by training or an orthopedist. You think, well, I only examine the upper extremity, and obviously for most of my patient visits, that's true, but musicians, you really need to look at the whole body. So you need a typical history that we all learn, but you have to add this detailed musical history. And specifically, and this is what we're going to spend a lot of time on here, is seeking out predisposing factors and risky behaviors that will not be volunteered. These individuals aren't going to recognize these activities as necessarily risky. And you do need to get some exact details of how this started and its progression. And then you need to explore this interrelationship of these physical and emotional factors. So this kind of thing doesn't really fit into the typical 10-minute doctor visit. So this is one example of, proposed history and physical exam for a musician. Comes out of the Performing Arts Medicine course manual. And again, quite detailed. Again, I didn't expect you to be able to read this, but, it's just to illustrate how detailed you may have to get to really figure out what's going on. So again, to quote a famous Hopkins physician, listen to your patient. He is telling you the diagnosis. And again, I want to say it's really a potentially lost art that, I've seen studies that the average doctor interrupts a patient within the first 30 seconds of them starting to explain their problems, because we want to zoom in on what we already think the problem is instead of letting them sort of tell their story. But again, this is just a better example of how detailed you might have to get. So these are the things you have to seek out, because then they're not going to volunteer these because it's sort of normal to them. We need to seek out these risky behaviors and predisposing factors. You have to ask them about if they have begun a new repertoire Do they have other medical problems? Do they have problems with performance anxiety? Are they preparing for a concert? What other exercise do they do? Or if they've been traveling, are they sleeping okay? Is your teacher aware of the problem, and is that helpful? Are they recognizing it, or are they pushing you too far? So the risky behaviors that you have to ask about, taking better care of your instrument than your body. And notice it's the instrument here with the helmet on and not the person. So playing an instrument, as we all know, and singing are physical demands that really must be taken pretty seriously. If you are trying to increase your practice time, you only want to do that about 10 minutes per day, and you need to respect, your postural and ergonomic environment, and that bodies are more important than juries, and we'll talk about that a little bit more. So again, risky behaviors, not compensating for asymmetric muscle work. Obviously, we're all right-handed or left-handed, and but most classical instruments anyway are played in one position. You never see a violinist playing, bowing with the left hand. It's just extremely unusual. So these imbalances adversely affect muscles, and you need to have some compensatory physical activity. And of course, you usually need some exercises to maintain and improve posture. Something more difficult to assess is, of course, playing with excessive force or tension. I mean, how much pressure is someone exerting on a string or a key, to get a particular sound? Is it more than necessary? In which case you end up fighting yourself. Again, despite hundreds of years of pedagogy, there's no technique that's universally correct or accepted, and that poor control of tension and effort often lead to overuse injuries. And in keeping with the not every person can do everything, choosing your technique and repertoire, to suit your abilities. Can you play Rachmaninoff and Tchaikovsky with lots of octaves and very loud sounds? So there can be an unsuitable fit between musician and instrument. Musicians actually adapt to their instrument because they often start playing when they're very young, and you can often tell by looking at a musician which instrument they play, almost because of certain muscles being, again, more developed. So this unintentional adoption of unhealthy postures, that's rarely is their thought given to the instrument modification, and even small deviations from normal posture can give problems. Again, you fail to consider your overall health when you're practicing many hours a day. Try not to work when injured or overtired or ill or dehydrated. But again, the tradition, same as in medicine, you show up for work unless you're dead, is very strong in this field as well. And again, if you need medication to be able to play, maybe you probably shouldn't. Playing in pain is a warning sign. So again, where do you play and where do you practice? Is it cold? Is it hot? If you're to have a tendency towards cool extremities, how does that affect your ability to play and practice? And, are you again playing always where there's a lot of noise, or in a band where you want to be heard, you have to play louder than others? So again, something as simple as carrying your instrument, if you always want to carry it on your right shoulder versus your left shoulder, you want to try and just distribute that. Obviously, the whole idea of how often appropriately is often lacking in this group of professionals. And then other hand-intensive activities. Obviously, people will be playing for 2 hours and then they sit down and then they check their phone or their email, or they're playing video games. And I used to tell individuals that, you may have only so many muscle contractions in your hands each day. So if you've got a type of paper, you maybe shouldn't practice as much that day, or you've got other activities that you have to be done around the house, yard work, etc. And conservatories still seem to always require papers, exams, and juries all at the same time of the year. And then there's psychosocial aspects of life, which are again not unique to this group of individuals, but I mean, the sports psychologists have been talked about for a long time. The recent problems with some of the high-level athletes taking time off to for mental health reasons has brought this more to light. But the things that make you a good musician or athlete, being a perfectionist, it's perseverance, sensitivity, introspection, are all qualities that make a good musician, but then they can also be driven, drive you to overdo things. And these non-musical burdens can increase your susceptibility. And then there's, obviously economic necessities. You got to eat to play, and you may need to play to eat. But playing through injuries lead to more serious problems and more economic loss later, but that's, again, hard to recognize. So this is, again, seems silly, but, to give musicians a quiz like this as part of their sort of welcome packet, if you will. Our therapist that I work with, Lauren, our hand center, often does this, but, do you play several hours without a break? If you've been away for a few days, you just pick up your instrument and start playing right where you stopped. Do you do any stretching? Do you warm up? You start practice with some of the more difficult pieces. Do you play even when tired or sore? You always play in the loudest range. Do you play an instrument that's heavy or large, the upright bass or tuba compared to a small violin? Do you exercise infrequently? Do you not sleep well? Are you a perfectionist? Do you always agree to do all musical projects? Do you feel like you're under stress? Again, do you always choose the most difficult piece to prove your ability? And has anyone ever suggested you review your playing posture in a mirror or film? So if you answered yes to more than a few of these questions, then you are at high risk for overuse injury, severe enough to limit your playing. So again, that's something, most for history, and then you've got to look at the predisposing factors that make you more susceptible to overuse problems. Obviously, inadequate physical conditioning, sudden increase in practice time, errors in practice, errors of technique, and not that I'm an expert in any particular instrument, but changes in the instrument itself you have to ask about, and if they had previous problems. Again, you need to ask them about their body mechanics and posture, their non-musical activities. Again, you're searching for some anatomic variations on exam. Obviously, gender is a factor, whether we like it or not. I mean, certain instruments are more difficult to play than others. The quality of the instrument might be a factor, especially the students, especially if they're using more than one. And again, the environment. So we're going to go over each of these and with a little bit of a how to deal with them if they're fine. But again, muscles that are tight and weak are more prone to overuse problems. And a common thing in musicians is that they feel that their hands are in great shape, but the rest of their arm, which the hands are attached to, might not be in very good shape, and that leads to substitution of these smaller muscles for the forearm muscles for these weaker, larger shoulder and back muscles. Your core, shoulder, and upper arm are all essential to being able to play a musical instrument well. So again, these properly conditioned muscles are better able to meet these demands and decreases the chance of static muscle imbalances and minimizes the risk of fatigue-related injuries. Sudden increase in practice time is the most common cause of overuse injuries. You know, it's I mean, almost every musician I've seen said, "Oh yeah, had a performance coming up, or I had something coming up, so I doubled my practice time." You know, and I always make the analogy that if you're already practicing 2 hours a day, it's like running a marathon with your hands, and now you're suddenly going to double that. And you know, think of what preparation someone who's actually going to run a marathon would go through. Um, One of the busier times of the year for me is often in August and September and October, after people have been through their summer camps, they went to the master's class. Um, Again, you know, you have this opportunity to be with this world famous musician perhaps, and you want to impress them. So you're playing not your new normal 2 hours a day, but now you're playing, you know, 4, 6, 8 hours a day. Um, and as not unexpectedly, a week later, you're starting to have some pain, you know, from muscles that never really bothered you before. Certainly the advice I always give is increase practice time no more than 10 minutes per day, and these gradual increases are essential. So again, you play a musical instrument with your entire body. So again, it's often a foreign concept to musicians. It's obviously more well known in the sports world of just warming up using large muscles as much as possible. In general, you want to limit practice to about 45 minutes. There is some evidence that after about 45 minutes of playing and doing a highly aerobic activity, that blood flow to the extremities can actually start to decrease. Um, you know, you need this rest period every hour or so to prevent performance drop off. And a cool down, again, a foreign concept to many musicians where they just pick up their instrument and start playing and then put it down and run off and do something else. This cool down is really not appreciated as well. Again, the technique, and again, best technique for each instrument is not uniform and depends very much on where you trained. And um, you know, motion analysis is very common in sports. You know, the videos of pitchers and batters and is very common to have that analyzed and forces involved. It's just starting to become more common in performing arts. John Chung up in Canada has uh, got a whole lab where he combines EMG recordings with videos and analyzing motions during violin playing and other instruments. But the key is avoiding playing with excessive tension, and you want to avoid gripping too hard. And again, you can see uh, people that, you know, have a death grip on a pencil, you know, where your hands are, you know, deformed and you blanch the skin when you know, grab something because you're squeezing it so tight. So you need to look for all this as well as ask them about it. Any change in an instrument should be accompanied by a decrease in practice time, which seems, again, very counterintuitive. But if you put new strings on your instrument, um, put new springs in some of the valves, you know, it's going to subtly change how much force you have to put on that instrument to get the sound you're used to getting. And that just teeny bit of increased stress might start leading to problems. So again, if you've changed the instrument in any way, you want to drop back your practice a little bit and then gradually return over a week process. Again, have you had prior problems? It's very hard, just as with athletes, you know, you want them to be 100% before they return to their previous very intense activity. And that is very hard to get them to do. You know, you should be free of pain and have good motion. And just as the sports therapist stress. Sometimes muscle soreness doesn't show up, obviously, right when you're done. And the onset of discomfort should not always be the gauge for rest. Okay, I'm going to practice or play until I can't do it anymore, or until my muscles are really tired. It's perhaps not the best treatment. Second most common cause of overuse injuries, of course, is really poor posture and general lack of conditioning. Again, it's something that is still becoming more common in the musical world, that you play with your whole body, so the whole body has to be in shape. You can't just use your hands. So this is poorly conditioned core, shoulder, and arm muscles are a big contributing factor. And again, treating only the painful hand without assessing the entire musician really often leads to short-term improvement or ultimate treatment failure. So it results in the muscle imbalances. Again, everything we do today, I like to stress, is in front of us. It's you're a keyboard, you're at a musical instrument, you're texting, you're playing video games. So your muscles in the front, your pectorals and flexors get a little stronger, while your posterior shoulder, scapular stabilizers, and extensor muscles tend to be weaker and lengthen. So again, everything we do is involving the hands. They have other jobs, household chores. And again, I like to stress there's only so many contractions in our muscles each day. So we do need to both ask about anatomy and but carefully assess it. We are not all the same. We have variations in joint laxity. There may be some tendon anomalies, interconnections between tendons that can occur. Arm, finger length can be a factor. And again, are you one of these I'm always cold type people? It takes a while to warm up. And not every person can play every instrument. Again, like it or not, females are more prone to overuse injuries just in a lot of athletic events. Females have higher incidence of certain types of injuries. When I see the 4'10" person that comes in and they're playing the double bass, and you think, geez, why did you choose that instrument? I mean, it's really, you really have to stretch and reach around to be able to play well. And this is just one example of a viola. It's come in different sizes, and the difference in injury rates between smaller and larger violas. So this musician instrument mismatch requires very increased awareness of conditioning and practice habits. So the instrument quality is can be a factor. You get a new instrument, which might be a little heavier. Again, a little stiffer strings. And again, if you have an instrument at home and as well as one at school that you're playing different, again, pianos are classic for this. So you may have different action force on the keys, and different requires a different amount of effort. And again, where are the practice rooms in most conservatories? Well, they're usually in the basement, away from probably the least favorable areas of the building. Again, you need to ask them when they practice. Obviously we do have circadian rhythms that would make it more amenable to practicing at a certain times of the day, or at least being consistent, but it's very routine. You hear people getting up at 4 in the morning to practice for an hour before they do this, or, after classes all day, or after their job, practicing at midnight, or practicing till 2 in the morning. So, but then you've got the person in front of you, you've acquired all of this information about what they think's going on wrong with them, or what seems to be having problems. And now you got to look at them. And again, I guess as an older guy now, I need to can always start to say, well, is it a lost art? But really, careful physical exam is really essential here, because most of it are other modalities that you would fall back on, like X-rays, like CT scans or MRIs or EMGs or any other test that you can think of, is often not going to show you what the real problem is. So you really actually have to examine them carefully, test individual muscles, and you often need to see them while playing and from different positions. And no matter how much they say, oh, when I do this, this starts to bother me. It's amazing how often you see once they pick up their instrument, how they change their posture, and um, and then it might become obvious or more obvious as to why they're having problems. But you need to look for these sort of static muscle imbalances. Sometimes it's just from observation. Sometimes you gotta actually test each individual muscle, and sometimes more than once, because again, you might have the strength for one contraction, but can you do this contraction many times and still maintain a proper position? So again, I ask by trying to determine the area of greatest pain. Is it really the tendon, areas where the tendons are sliding is the most painful? Is it sort of the muscular tendinous junction area? Is it the muscle belly? Is it the muscle origin at the joint? And you need to examine, each joint and its muscle strength, especially around the shoulder and core, and again, even into the lower extremities, because, as you know, with a lot of sports, and if you have a good core and lower extremity strength is essential to being able to have easy flow and motion with your upper extremities. And again, assess which joints might be tight, some might be lax. So again, it's easy when you look at diagrams like this. Okay, standing posture where everything's lined up. The neck is lined up with the pelvis and the spine. When you're looking at an X-ray, perhaps, that you can see it, but it gets a little harder as when you put people in even exam gowns. But again, looking for these subtle changes, increased back curvature or loss of curvature. Again, now you start putting it on the whole body on there, and again, can be a little more difficult as to seeing exactly how they're standing. And again, is the pelvis extended? Is it flexed? Again, real examination. Obviously, you don't have people stripped down naked, but just looking at this person, you start to think, well, is there? It looks pretty symmetrical. Pelvis is level. Shoulders, maybe some little difference here. Right side muscles are a little more developed. You got to look at it from the side. Is the center of the neck over the shoulders, over the hips, over the knees and ankles? Does he lock his knees when he stands? And then you have him move a little bit where they bend over. Again, they have any scoliosis, any other asymmetries? Do they rotate to one side? Can they actually touch their toes? Are they too flexible or not flexible enough? So this is very much necessary. And again, the specific areas, even if they're not complaining of neck problems, but again, this is how it comes down through the years. I'm not sure I'm pronouncing his name right, Hopkins, French composer, popularized this sort of tilted neck and playing the flute. So again, imagine what that's doing to your neck and, cervical vertebrae and the neural fragments coming out. And is that related to the problem? Again, is their neck sort of relaxed? Or have they tightened supporting muscles of the neck, either in the front or the back, and shifted things? And as they often say, so goes the neck, so goes the rest of the body, or so goes the head. So something to keep in mind. This is just an example out of Richard Norris's book, who I'll show you that reference a bit. Again, do you play with the neck straight? And then it's increased stress on the shoulders, or you tilt your head to make it easier on your arms. But now it's your neck is more of a problem. Or maybe can you bend the instrument so you can keep your neck straight and have your arms down? Again, you never see anybody playing an orchestra though like this, do you? You just don't see that routinely. So again, working down the body, the shoulder, again, the posture. This is just one way of thinking of your, your trapezius muscles and neck muscles, are sort of suspending the shoulders. You've got the elevators, you've got the retractors, and they all have to balance. And you really need to, again, test these. I spend a lot of time checking their internal rotation strength, external rotation strength, subscap strength, posterior liftoff. Can they elevate their arms without, more than once? The range of motion and stability. Again, this individual, and again, you think that there is a difference. I just asked him to raise his hands. I didn't say make one higher than the other, but again, you see subtle differences in contours of latissimus, one side versus the other. And again, these are subtle clues as to their overall conditioning. So again, specifically looking at shoulder blade movement, again, I stress to individuals, as we all know, your only bone actually holding your arm on is your collarbone, and all the rest is muscular attachments, and they all have to slide together smoothly. And again, looking for asymmetries, looking for, muscle development here is a little bit more on the right, this right-handed individual. Scapula is probably not moving the same. And again, the differences in the contour. And you need to look, again, this is not something that's casual. You need to have them go through this range of motion and look carefully. Working down the arm, again, their elbow, hand and wrist. You assess the range of motion. We know most people can go to 90 degrees of extension, but most people cannot do 90 degrees of flexion at their wrist, but a lot of musicians can. So that's actually not a good thing, because it means you've got some lax joints. You need to check for this carpal stability, especially mid-carpal flexibility, where you get these clunking sensations. You have to assess the distal radial ulnar joint in both, pronation and supination. And again, you have to see their hand position while they're playing. Are they using excessive ulnar deviation or extension or flexion, the wrist while playing their instrument? You can picture the guitarist where they're, trying to be cool and have the guitar way down low, so they have to hyperflex their wrist to, hit the strings. All of these things become important, again, in the overall alignment, where you want sort of the ulnar half of the hand to be a little more in line as opposed to the thumb side. And again, the fingers, checking for strength of each individual finger, looking for sort of tendinous interconnections, which some people have. You got to check the strength, and you got to assess the joint laxity. This is one way of checking that a certain percentage of the population will have no FDS tendon to their small finger, and they can't flex the PIP joint unless you let two fingers come together. And you need to describe, again, the position of the hand and the blanching of the skin or collapse while playing. On a piano example, like, are they collapsing the metacarpal phalangeal joint here? Are they keeping it in a more flexed posture? Because as soon as you extend all the way or hyperextend a joint here, well, now you've lost the mechanical advantage of your intrinsic muscles, because they're not able to contribute to the force. So then you're using more force in your fingers. And again, you've got to be able to check for this. And of course, most of the time, well, again, you might sit while you're either practicing or performing. And again, how do they sit? Are they sitting properly? Are they really sitting on the ischial tuberosities where you should sit, or are they rolling back the pelvis or flexing forward? Again, how do they sit in the chair? Is this, this posture certainly seems like it's more aligned than this guy who's got the slouching quite a bit. Again, the type of chair they're sitting in might be a factor. Here's playing a cello, sitting a little bit forward. You know, the back is more aligned as opposed to here where it's flexed. Pelvis is flexed. And again, different postures, how the shoulders are more rounded here. If you sit back properly and have appropriate support. But again, you can see the head is in front of the shoulders, which is in front of the pelvis. So again, these are all subtle things that are contributing to their pain in a lot of ways, even if they're not coming in and saying, oh, my back hurts. They might come in and say, well, my left hand is hurting you. But then you start to see all this and you say, well, these muscles are all weak. That's why you're gripping your violin too tightly and holding it up with your hand as opposed to your chin and your back. And then you've got to keep looking down the body because even though, again, they often have upper extremity complaints, you use your whole body to keep the position. So they have some scoliosis, kyphosis, it's the pelvis level. And the knee position, do they lock their knees when they're standing? Do they have flat feet? You know, all of this becomes important. And then you've got to see them play. You know, does their posture change when they're just relaxing here versus when they put their hands on the keyboard? Because again, the cause of the pain is often remote from where the pain is felt. And again, determining this cause requires the whole evaluation. And it's very common to have a mixture of tight and loose joints. Some joints might be very tight, others could be very loose. And again, observing while playing is critical. And again, we've talked already, the treatment to the painful areas may fail to provide long relief. Just a quick review of some of the other, you know, joint hypermobility, which we talk about a lot. You know, can have a lot of, I found this website, Hypermobility Syndromes Association, is quite good. Has lots of useful information, but, you know, a lot of us are familiar with the Baton score and the 5-point questionnaire about flexibility. And again, how much that might be a factor. And if you have hyperlax joints, well, you need stronger muscles to compensate. So again, we talk about this benign hypermobility syndrome. You know, this may be more generalized or limited. And again, the laxity increases the stress on their extrinsic muscles as they try and compensate. So again, about 20% of musicians will have some hyperextensible joints, especially in the hands and wrists. And again, the treatment is not to stretch those joints because they're already too lax, but maybe to strengthen the muscles. And the strengthening on like intrinsic strengthening is not something you often do. Quick, you know, we're not going to focus much on this because we could spend an hour on each of these topics if you wanted, but we do see these in people, violinists, guitarists who might, upright bass players who hyperflex their elbows all the time, might have ulnar nerve problems. But these are usually more obvious. They come in and say there's always some numbness and tingling. Once they start introducing that symptom, then you've got to focus more on the nerve. You know, shoulder and thoracic outlet syndrome. I mean, I'm a believer. I know there's people who don't think it's a real problem, but how you know, the arteries and nerves come out of the chest and in the neck and meet and go under the collarbone, under your pectoral minor muscle here, out into the arm. And again, because everything we do is in front of us, it's very common that the muscles are pulled forward. As your shoulders come forward, we know they also tend to drop down, which does put a stress on them. I often tap over the supraclavicular area to see if they're tender. And a test I often use is called this elevated arm stress test, where you have them go into sort of a stick 'em up posture, have them open and close their hands a few times, and see if that reproduces their symptoms and how quickly that can reproduce them. And those are all, because it's often a functional, you know, it's not usually a static problem. It's often a functional problem. Focal dystonia is a very significant problem. I mean, fortunately, pretty rare. It's not well understood, but this is where a condition where someone suddenly starts to lose control of their fingers, particularly, although sometimes it can involve the oral muscles and the embouchure of the mouth, sometimes singing voices. Often the fourth and fifth fingers are involved. The key here is often it's usually almost always painless, and it's very difficult to treat, and we could focus hours on trying to do that. But this is just one trying to illustrate that this person playing the clarinet here is starting to lose control of the fourth or fifth finger, and it involuntarily either extends or flexes, and they have to work excessively hard to try and straighten it. And the more they work at it, seemingly the harder it gets. So this is, again, is a little bit about treatment, how we might, warm up large muscles for 5 minutes away from your instruments. This is what I recommend people practice for 45 minutes, cool down for 10 minutes. And then you can repeat that practice. If you have to play for 2 hours, well, you do this sort of hour routine, take your break, and then repeat that. You want to limit your practice of difficult passages for 5 minutes at a time. And again, I can't, how many times you start to see people, okay, I've gone over this difficult section, I practice that for a half hour, straight all over. Had the privilege of evaluating Leon Fleischer, the famous pianist who had problems with his right hand, and from exactly that problem, practicing difficult problems, difficult passages over and over and over again led to his vocal dystonia. Again, a practice setup, again, something to at least talk to them about, how they do it. Is their neck twisted too far? Do they have a music stand, proper lighting, the environment? All of this can be a factor in contributing to a less stressful practice. And again, treatment is very individualized. Prevention is best, this warm up, stopping play if it hurts, assessing the other activities we've talked about, awareness of these individual risk factors, not playing in pain. I mean, again, it's hard to concept to get it through to them, and, seek appropriate evaluation if symptoms don't rapidly improve. And what I like to do is relative rest. If somebody said, well, it hurts when I practice for 2 hours, well, okay, practice for 20 minutes then, and take a break and then come back. So you try and keep them going, because the last thing a musician wants to hear is not stop playing. Therapy is always part of the treatment plan. Intrinsic muscle strengthening is usually necessary. You avoid stretching lax joints, stretching the tight joints. I've been fortunate enough to have an Alexander Technique therapist in our clinic all the time. And they amazingly see things that I don't even see. Sometimes you talk about instrument modification, smaller piano, unusual shaped violin, but this is very easier to play. Curved head on the flute we've talked about. And we can go quickly. I know I'm running out of time here, but this is a violinist I presented at the beginning, and she was found to have very lax wrist joint, hypersupination of her wrist, and we actually had to stabilize that, but we were able to get her back to playing. We had an orchestra percussionist with a typical bilateral thumb CMC arthritis, and we were able to do a modified technique to rebuild his thumbs. Another orchestra violinist developed a lot of biceps tendinosis, which we were able to treat with relative rest, therapy and rehab and rebalancing his muscles, and able to return to play. A harp player, which I think is the hardest instrument to play. If you've ever tried plucking the strings on a harp, very hard on your hands and arms. Just again, was in such bad shape that she had pretty functional thoracic outlet syndrome, and we were able to use their perfectionist ideology to get her to focus on the right aspects and get things under control. For more information, I mean, this is the course that Performing Arts Medicine Association puts on. It's generally say it's a couple of days, although it's a pretty intensive review if you're trying to review all these articles and look at these lectures over just a couple of days. Other resources, the Arts Med organization is the Performing Arts Medicine Association, Performing Arts Medicine textbook. There's a journal, and I found this book quite new. It's hard to find these days, but Richard Norris was a physician who's also a flute player, and he had a nice manual here. It's hard to find these days, but you might be able to get it on Amazon. Europe, especially England, is way ahead of the United States in focusing on problems of musicians, and they've published several textbooks. This is their current Bible in this country. Alice Branfenbrenner was the founding of probably the first real musicians clinic in this country. And this is a great book. Other books, which, two good, well-known hand surgeons, to be honest, on audio, although I can rarely get the Hand Society to focus on any musician problem. Bird, another English physician, this is a nice small book. And some more popular books, Musician's Body, Body Mapping, Musicians in Motion, Playing Less Hurt. All these are good books. So I appreciate your time, and thank you for allowing me to present this information to you.
Dr. Wittstadt, that was comprehensive and very informative, and thank you for your time. You certainly captured the essence of our intersection of performing arts and sports medicine. You certainly tied those two together very much, and I want to thank you for your time. I have to jump off. Dennis, I'll let you handle any questions that want to come up.
Yeah, I'm happy to answer any questions. I got no other demands today, so that's good. But again, it's been very much a pleasure to prepare all this. And,
Thank you, Ray.
Thanks, sir. Thank you. But yeah, if anybody has any questions, I'm happy to answer anything. I don't know if we can either ask or, I always hate the chat stuff where you have to read and read and talk at the same time. But
I don't
thank you
think
for
there's
the
anything in the
opportunity.
chat at the moment, so if anybody has anything, that would be awesome. Go ahead and just unmute yourself and come on in and let us know. Does not seem to be the case.
All right, I know everyone's got the day has started. Time to move on. So
No questions, just a big thank you,
Yes.
Dr. Wittstadt, for it really was a nice comprehensive just insight into performing arts medicine. I think highlights kind of our unique programming that we have here and what you've been doing at Curtis, and just looking forward to learning more from you and hopefully collaborating in some capacity.
yeah, we gotta get this together, and for
Yeah.
the benefit of the individual. Like I said, I see a lot of Peabody students, a lot of people from the orchestra and other colleges, Towson and Goucher, and not too many. I haven't really, although I'm an orthopedist, I've very rarely seen, dancers. I made a trip up to the Miller Institute in New York. If you're familiar with that, I did a road trip up there where the whole clinic focused just on musicians and dancers, and that was quite illuminating as to there was a physiatrist there who was very into dancing. I play in a band with some other doctors, and one of our bandmates is Lou Schoen, who's a foot and ankle specialist at Mercy. He was at Union, and he took dance in the past, so he's attuned to that. So I've sent a few people to him over the years that needed particular types of problems. So it's like I said, interesting group of individuals that need treatment, and it's been a pleasure trying to take care of them all these years.
And thank you for doing so.
Yes.
All right, well, thank you all. I really appreciate it, the opportunity. I'll be happy to repeat that or expand some areas if you want. We can go more into the nerve problems. I really have no particular expertise on focal dystonia. I've seen probably half a dozen people over the years with that, and boy, very tough to deal with them.
Yeah.
But we could talk about that too. So-
Great. Yeah.
All right,
I'll
well,
definitely
thank
reach
you.
out and we'll
Thank you again.
All right, thank you. I'll leave now. Thanks.